Hi guys, so I want to talk about another policy today, and today's policy is about the laser. So when it comes to laser, just the basics of like the LA. So we use the Fotona laser, the StarWalker and Dynamis, and these are like high grade gold standard lasers. They work in two different ways. One's more ablative and fractional, where you sort of like, you get the downtime and the burning of the skin, or I suppose the heat, stacking heat in the skin or peeling the skin. And the other one's about pigment and tattoo removal, and that's the StarWalker. So even before you walk in the room, we have a sign on the door saying, this is a laser room, class 4 lasers, blah, blah, and stuff like that. And once you're in the room, you got to wear special shields for your eyes, to cover your eyes, because, you can go blind if the laser hits your eye. And we use goggles and special protective wear like that. And even when it comes to the machine, sterilization, we go through all the sterilization techniques. And with the laser, we have like a full protocol, like policies and protocol, what settings to use for what certain types of skin types, because you've got skin types. Fitzpatrick type 1 to type 5. Type 1 is like a very fair skin, like Celtic, or, quite English, quite very fair. And type 5 is like a darker skin type. So the 4 and 5s, even 3s, you got to be very careful with the laser treatment, especially if it's heat, because you can get pigmentary hyperpigmentation. So that's very important. So we have policies and procedures on all our laser, what protocols to use, how to use. We also follow we actually do now, full stop, is we do a consult first. So you don't just come in, jump on the bed and have a laser. Look, if you're on your second or third laser treatment and it's the same laser treatment, yeah, that's okay, because you've already been through it all. But Sharon does a full consult. She goes through, who you are, what sort of treatment you want, your medical history, your medication history, your laser history, history of any skin problems. Have you had keloid scarring, rosacea, melasma? What's your downtime? What sort of cost? What are you looking for outcomes? And even environmental factors, if it's like rosacea or melasma, are you having hot showers? What type of skincare are you using? Are you on any medications like retinoids that you can't actually have laser? How often are you in the sun? So Sharon goes through a whole list of questions, when it comes to your medical history, when it comes to the laser, before even performing a laser or even thinking about a treatment. And then you come up with a treatment guide. And with the treatment guide, one of the biggest things for people is downtime. Like how much downtime do you have? Do you have 5 days where, you're happy with your skin being a little bit swollen, or it's flaking off, or it's red, or peeling? And the other part is like how much time do you spend in the sun? So laser is such a good treatment for a winter treatment. But if you've got a suntan and you're in the sun all the time, laser is definitely not for you coming into spring and summer, because